Melanie Matthews from the Healthcare Intelligence Network, bringing you the latest healthcare performance benchmarks on accountable care organizations. ACO activity has doubled in the last year, according to our second annual survey on ACOs. This year's respondents have so much faith in the accountable care model that even if the U.S. Supreme Court had not upheld the constitutionality of the Affordable Care Act, two-thirds of them said ACOs would have survived. 31% of 2012 survey respondents now belong to an ACO, up from 14% in 2011. Just over half of this year's ACOs also participate in the CMS Shared Savings Program, an accountable care organization for Medicare beneficiaries. 200 healthcare companies took the 2012 ACO survey, which also identified a shift in the ACO administration from hospital-led to physician-led. Physician-led ACOs were reported by a quarter of 2012 respondents. In contrast, the number of ACOs headed by a hospital dropped dramatically, from 32% in 2011 to around 5%. Healthcare consultant Steve Valentine, president of the Camden Group, includes ACOs in the top trends impacting healthcare in 2012.
We expect two major initiatives in 2012, bundled payments as well as the accountable care organizations. Of particular note, we will actually see more activity with private payers around accountable care and bundled payments than probably Medicare-designated sites. All hospitals are concerned with a value-based purchasing program because we now begin the process of either getting a little additional reimbursement or a reduction in reimbursement. So quality matters, the transparency matters, and hospitals are now having to deal with the bundle payments and accountable care.
According to this year's survey, the typical ACO is smaller in 2012, as the number of active ACOs with 100 to 500 physicians dropped almost 50% in the last 12 months. One-third of current ACOs have between 1 and 100 physicians participating. Organizations have become more efficient in ACO creation. 41% say it took less than a year to launch the ACO, up from 25% in 2011. All responding ACOs are using electronic health records. With all of this ACO activity, what are the challenges of this emerging model of care? The perennial hurdles of managing staff and building buy-in for a new program. For more data from this survey and a host of resources on ACOs, please call HIN toll-free at 888-446-3530 or visit us on the web at store.hin.com. Like us on Facebook at www.facebook.com/The Healthcare Intelligence Network, or follow us on Twitter at www.twitter.com/H_I_N. This is Melanie Matthews for the Healthcare Intelligence Network.